The COVID-19 pandemic has impacted lives globally. While on one hand, people across the globe are largely confined to their homes, with businesses and educational institutions all shut down in an attempt to stop the chain spread, on the other hand, doctors, healthcare workers, and medical staff members are leading the battle against COVID-19 from the front. Dr. Krishnapriya Banerjee is a courageous and inspiring example of women frontline warriors. She is a general physician and is working with COVID patients who recently got the vaccine. She also has had the experience of fighting her own battle with COVID. How are you feeling these days?
I'm feeling very uncertain. The people, my relatives, family, near and dear one, for everybody, the current situation is worsening and I'm very much worried.
Please describe your experience when you contracted COVID. How were you feeling when you realized you were COVID positive? And how were you feeling when you were going through it? What did you do to help yourself recover and encourage yourself through the process?
I contacted COVID from my patients definitely because if we are in touch with a COVID patient more than 20 minutes, it is inevitably there's a fair chance of getting it. But that time people are not detected and a lot of people with coming symptoms which are not very sure of COVID. So I was in touch with them definitely and got it from them. And after that, when I tasted positive, I tested positive, and I just I understood that I have lots of work to do. Being a person with two children, one dog, and living in a foreign land, I have to take a lot of I have to do a lot of activities and resources filling the stores. Everything was bothering me, but somehow I managed it. By the time I was quarantined in my own place, and the room where I quarantined is a separate bathroom and a balcony. There is and that particular room is totally cut off from the rest of the rooms. So I was in an advantageous position that I had enough space for myself. So I was totally secluded, isolated. I maintained well. I was from the very beginning, the day I knew that I am positive. Before that, I was taking a lot of karas and other things, thing, that thing. But when I became positive, I was really meticulously taking all the medicines I should take. Lot of vitamin C, zinc, and antibiotic. One of my friend helped me and guided me throughout the process how to take ivermectin medicine, and also I really didn't neglect myself. I kept myself positive. I kept myself motivated and organizing things from home properly. My house was smoothly run that time. Many people helped me, so like it was not much, it was really not tough for me to maintain everything. Overall, I was in a very positive mood. I, I just, this 9 days to 11 days, I utilized properly. My time management was good and I learned many things. So that way I maintained myself and kept happy.
Ma'am, you must be having a very holistic perspective in terms of having treated patients who have contracted the virus, in terms of battling the virus yourself and seeing your family battle the virus, and now getting the vaccine. Has your experience in suffering from COVID changed the way you deal with your patients who are suffering from the same? If yes, how?
Definitely, because my whole thing, before I contacted COVID, I was a person who was just thinking that why to bother about COVID anyway? I'm not going to treat them. They will be hospitalized, they will become, they will be separated, they will be isolated. So my role is very minimum. But once I contacted it, I realized that understanding this disease in the beginning and diagnosing the disease the very early phase can not only can save life but the cost, but the damage. So my whole my perspective changes. I just, even when I was COVID positive, I was in quarantine. I treated not less than 10 patients over telephone. And even also from the beginning, the moment they come with little bit of symptom, my alarm, that ghanti, it bell rings in my mind that okay, I have to be very watchful. I have to, this patient should not be out of my hand. So this whole thing is has helped that time and now also. And truly speaking, I have treated so many patients. So far, none of them died. And this is really a great achievement. You can say that prevention is better than cure. So here, early diagnosis is very important. So that is what my whole funda is, that diagnose early, treat early, don't allow that person to be complicated.
Given this situation with the virus and the information explosion all around us, everything can tend to become very overwhelming. What is your way of dealing with this? What keeps you going these days?
Keeping myself positive is very important. I draw a lot of energy and courage from my prayer. And I one principle which keep me keeps me very motivated is that we cannot live only for ourselves. If you help other, if you live for other, if you can at least wipe tears from one eyes of one person, you will feel that your life is fulfilled, and you will feel very much energized. And this thing I am doing, I'm lucky enough to do daily with. And there are a lot of things that I can do. Lot many people help, and the thing they want, uh, comforting them, you can say. So this keeps myself motivated, and this COVID has taken my fear away. I'm really not afraid because I had it earlier. I understand that disease dynamic and the process, what it can do and how it can go. So being very vigilant. Now you cannot prevent COVID. It is out of our hand. Prevention is out of our hand. So what we are doing is that we are just, you know, you have to diagnose early. Early diagnosis and prevention of complication, prevention of a patient from pneumonia. That is the rule of the game. Game now, because if you can do that, you can save lot of cost, and not only that, patient will get a healthy life.
What is your message to individuals who are in similar positions as you and are playing similar roles to that of yours, given the current situation?
See, be positive and focus your focus on your physical and mental health. Try to connect to your friends, families, relatives virtually, and if you have any social platform, use that to educate others. That is very important.